Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the TT Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. It is October 1st. Yes, we have gotten to October already. I know you blinked and it was May, you blinked again and it was October. Yet here we are. I am super excited always about the month of October because it's my birth month. It's the birth month of my only child, and it is the month of Halloween. We get candy corn, we get all of the good pumpkin spice, like good times to be had in October. And I'm also very excited about today's topic because it is a topic that is near and dear to my heart as we celebrate Breast Cancer Awareness Month in October. I'm going to try to stay focused and make sure that I give you some good information as we move forward in our wellness journeys. So today I attended here in Columbus. We have a John B. Amos Cancer Center, and today was the annual breast cancer awareness luncheon, and the theme was from that of Egypt, not to be in denial. So super cute. That's why I've got a little festive pin on. I had a fedora on earlier, so I'm feeling incredibly excited about opportunities to just talk about prevention and wellness, but also intervention and all of the different things that come along with a breast cancer diagnosis. So I think if you have followed me for any period of time, I've likely mentioned that my mother was a breast cancer survivor for about 20 years before it ended up ultimately metastasizing to her liver. It metastasized to her bones, into her brain. Before that, she got really a long time with us when doctors predicted that she would not. And so I'm always very thankful that I got a chance to be along in that journey because it showed me a lot of different things from preventative care to early intervention to having to go and get that, hey, it's come back diagnosis, to we don't want to tell your children, we don't want them to be worried, to like, hey, you've got 6 months, to 6 months turning into years, and then like, oh, hey, no, actually, you got 6 months. And that time being accurate in hospice care and caregiving and all of the things. And so I want to talk a little bit today about some of that journey that some of you may be experiencing. I also have a sister. She's actually a really good friend of mine that I've known since the church daycare days. So she has become a sister to me over these years, and she is also a survivor. So I'm very thankful for that. So let's get into it. So I will tell you that a diagnosis of breast cancer, it comes with a lot of things, and how people respond to that varies. And so there isn't, I want to be really clear with you all that there isn't necessarily a right or a wrong way. I think more of what I want to share today are some things to just take into consideration depending on where you may be in your journey, or in this place of prevention. Maybe there's a family history. So let's start there. I will tell everyone the importance of knowing your family history. And I know that some of you, like me, were adopted and you don't necessarily have the history of your biological parents, but you still want to engage in preventative care. We're at a point now where often insurance isn't necessarily focused on our wellness as much as I feel like it could be. And so you do have to be an advocate for yourself with regard to asking questions and being able to get information about when you're able to get screening kinds of assessments. And I do believe most people will tell you that I feel like everybody ought to get a baseline MRI, but I definitely know insurance isn't covering that. But what I will say to you is get a good, thorough history. And do know that even if you don't have cancer in your family, in your immediate family, that you can identify, there are a lot of different types of cancer, and some of them can be recessive. And so there may be some recessive traits in the family, and you may not be aware of them, but you get as much history as you can. And this is part of the prevention piece. We're going to do prevention, early intervention, and then, of course, unfortunately, when that cancer comes back. So I'm going to try to address those things. Again, I'm going to try to stay focused. So, prevention wise, get that good family history. Now, that could mean a lot of different things. You may have to talk to a variety of people. Some people don't like to talk about cancer. You still have people who are in generations where it's the C word and people aren't really comfortable discussing their health. And so sometimes you won't be able to necessarily get a full picture. So you may have to talk to multiple people. But also asking questions about just certain things that happen as women when you start your menstrual cycle, the density of breast tissue, fibroids, like so. Just getting good history can help because there are a lot of things that can put us at risk. And so, as you are talking to your provider, you want to give them as much information as you can because that way they can determine for you when is going to be the time for you to get your first mammogram. I know that there are still people who are very anxious about mammograms, and this is for men and women. Men and women both get breast cancer. Though there are more incidents of women having it, it's not uncommon to have in men as well. And I know for sure men are absolutely afraid of getting a mammogram because what do people say? Like, oh, it hurts. I was bruised, all of these things. I will tell you that technology has really advanced, and I will also tell you that there are great places where you can go and get a mammogram, and the staff is outstanding, and they are going to do their very best to ensure that the process is not painful. Can it be a little uncomfortable? Yes, your breast is being shelved between two plates. However, now with the imaging that they have, the angles that they can see the breast tissue at, like you really get much better imaging. And because of that, you have a much better process when you go get a mammogram. So do not be afraid of the mammograms and make sure you schedule them. Insurance will tell you you don't have to get a mammogram every year. But what we recognize is there are a lot of things that can happen over the course of just 90 days when it comes to breast cancer. And so you want to be preventative and get those screenings every year unless you've been told something otherwise. Some of you may have had mastectomies for various reasons. Some of it because you have the family history and you understand your risk factors, and so you've opted to get a mastectomy. However, that is one of the best ways for you to be able to get a good sense of what is going on with your breast tissue, and also know that there are a lot of other things that you can do as well now when as a part of screenings, particularly if you have dense breast tissue, and a lot of black women do have dense breast tissue. And so you may be asked to do an ultrasound as well as getting a mammogram. So you want to know what your options are. And you also want to be clear about what insurance covers and where you can go get those services if you're not in a position where your insurance would cover. The other thing I would say to you, and if my gynecologist heard me say this, my nurse practitioner, she's amazing. She will say, when she's like, have you been doing your monthly breast exams? And I just start laughing because she already knows I do a terrible job at that. However, I do try my very best to be mindful of it. And what she'll always say is have your partner to do it. Like, tie it to the first day of the month. Like, allow yourself to be able to give some kind of connection to it so you can ensure that you get it done. Because oftentimes people will tell you that it wasn't the mammogram that actually clued them in that might be something wrong as much as it was they felt a lump. And that was my mother's experience. She will say that God clearly told her to touch her breast, and immediately where she touched it, she felt a lump. So we want to know our bodies really well, and it's important for us to understand what they feel like, what that dense breast tissue feels like. And so if there's a change, because you could notice a change in how the area around your nipple looks. You may notice a change in there's a discharge. You might notice a change in the texture. There are a lot of different things to be on the lookout for. So you want to really talk to your provider about, like, hey, when I do these monthly breast exams, what should I be looking for? All of these are a part of your prevention plan. I also will tell you have a good team. So ensure that you are with providers that make you feel comfortable, providers who allow you to feel heard. We call it culturally responsive. Ensuring that you are with people that make you feel as if that they're on your team, they're on your side, they want to understand, they want what's best for you. And it may take you a few different providers until you get that. You may have to go to a different area, you might have traveled to be able to ensure that you have that. But you want to have a good team of providers who understand your family history, understand your risk factors, are going to hold you accountable to that good preventative care, and are going to send you to places where you are comfortable feeling like you can trust this technology and trust that you're getting accurate assessments and that they're making sure that you're staying on track with anything that you would need to do. And that may include things like changes in your diet. Okay, then we have what happens when I do find that there's a lump. So there's a lot of different processes that can occur after that, right? That may initially be a mammogram, that may end up being an ultrasound, that may end up being a lumpectomy where they take a piece and biopsy it to ensure what's going on. And then that can lead to a lot of different things, right? A lot of people have anxiety about it going in to get that lumpectomy, like that. Doesn't sound like a fun procedure. You know, they deaden the skin around it, but they are taking a piece of your breast, right? And so, for a lot of people, myself included, not a big fan of needles, definitely not a fan of any surgical procedures. So, you want to make sure that you have that support system in place. And again, providers who you can trust to ensure that when you're going in, that you're able to try to get that anxiety down as much as possible. Some people may need to take an anxiolytic to help them through. That good Xanax, that good Klonopin, like, hey, we're just gonna kind of calm you down before you go in here so we can get this procedure. But also that you're talking to people about your anxiety. And sometimes it's too early to think about the worst possible case scenarios because whatever we feed sometimes is what will grow. But it may be that I need to tell people that I'm anxious and I'm not carrying this inside. I think a lot of times for women, we're having these things that we're struggling with and we don't share it. We're just pushing through, we're just going. And what is that doing is contributing to our stress load, right? We've talked about cortisol and the impact of it on the body and how with prolonged stress, we don't heal. We are at risk for all of these different things and my body starts shutting down. So I want to make sure that I can lighten this load by being able to have some people who can walk me through this journey wherever it may be. It may end up that it's non-malignant and we're just watching. It may end up that, hey, there's a recessive gene in there, so we need to keep a look on that. You might have to come in quite frequently, every couple of months, to get additional scans. Or it may be, unfortunately, that it's malignant, and then we have to kind of talk about a course of action. As you talk about that course of action, again, I will reiterate the importance of a good team because now you're adding an oncologist and you may be adding a lot of different types of providers. And so, if you have that core provider that you trust who's going to be able to give you recommendations to places that they trust and can ensure that you're getting the type of services and help that you need, because like most of us, we don't know specialists in a given area. We haven't had to deal with things, and so I don't necessarily want to just be going through the internet and trying to find people, or going through my insurance and they recommend me to places that may not necessarily be a good fit for me. So being able to identify people maybe who have utilized the services there before, people that you trust who have had a positive experience, so you get some options for some places as recommendations, because in this journey there are a lot of different components, and so you want to make sure that you set yourself up to have the most positive experience you can possibly have. I will also tell you that people have a varying ranges of emotions with regard to grief, with regard to just feeling numb, overwhelmed. And then we have the people that are like, all right, I know I'm going to have this procedure done. I'm going to get the chemo, the radiation, have this surgery to remove whatever. And so we get caught up in the problem solving part of it. And so we don't allow ourselves to feel. And so we want to make sure that we're actually feeling, that we're dealing with these emotions, that we're understanding this process and then the fears that we may have, how it's going to impact our families, talking to our families about it. And sometimes people will go through treatment literally by themselves and not share with anyone that they have a cancer diagnosis. So we want to make sure that you are aware that that is not the recommended route, right? I told you there's not a wrong and a right way, but there are some things that will allow you to be able to get to the through the process in a way that gives you less distress and also allows you to be able to have some support along the way. Because yeah, like um, the nausea, the loss of hair, the skin burns, like all of these possible things that can come from the treatment, having that port put in, getting blood drawn, getting hooked up, having to get that port flushed every time, sitting there. What we talk about, the one of the young ladies that was sharing her story today talked about chemo light versus, chemo heavy, chemo strong. And so when that chemo is really strong, like, it affects you in a lot of different ways. And being able to be a part, and this is where that team comes in. Like, I might have a cancer support group that talks to me about, like, hey, this really helped me with nausea, or this really helped with the skin peeling. This really helped with the burns that came after radiation. This really helped with me being able to navigate losing my hair. And a lot of times when you have that good support team, they're also going to put other things in place. Like, they will talk to you about, like, hey, do you want a wig? Do you want us to, help you with that? Do you want us to help you with being able to, like, your skin gets pale, you look a little sickly, like, there's a lot of things you drain because chemo, again, is killing cancer cells. So we're talking about some strong stuff that's going in our bodies and how we look. And so some people are like, I just want my face not to look like what I'm going through. All right. So being able to talk about good skincare while you're going through that. Maybe you're a person that wants some head wraps or some bandanas or some caps, right? Being able to talk about that. Like, when do I know when to leave? How do I navigate being around other people? Am I putting other people at risk when I come home from having this chemo done? Do I need to just, like, throw my clothes in the garage in the laundry basket and not let anybody be exposed to them? So these are the kind of things that people can help walk you through, particularly those who have been through the journey and gotten on to the other side. Because what's really important in this process of intervention is hope. To be able to recognize that this place that you're in is temporary. It's not a great place to be in. Some days are going to be really rough days. But if you can be able to have some hope and find some joys in there, take the rest when you need it. Recognize, like, yeah, like, my energy is zapped after an hour or two. What's going on with that? Being able to understand how your body is going to be affected, like, these are the things that are going to allow you to be able to better navigate this space. And so having those resources, American Cancer Society, you may have an online support group, you may have a support group in your area, there might be a support group through your church, there might be a support group that's housed in your oncologist practice, there may be a support group that's offered through a cancer center that you have in your area. So being able to understand what's available to you is really important. The financial piece, this can be a very significant financial strain on you. Everything is not going to be covered by insurance, and all insurances are not the same. And so being able to understand, like, oh, there's a case manager that can help me navigate it. And even though I may not need the resources now, let me go ahead and fill out the paperwork. So in the event that do need them, I've already got that resource there. And even as I'm going through this treatment and after this treatment, that I can still utilize this support group, and that I don't have to be in this experience by myself. Who are my family members that are going to show up for me? Who are my friends that are going to show up for me? I might have colleagues that are going to show up for me. I might have church members that are going to show up for me. Because what if I'm having to be out of work, and maybe I'm not in a position where I have FMLA to protect my job, and maybe the people that I work with are not in a position or not necessarily inclined to ensure that I'll have a job when I come back. And so being able to navigate all of those things, who's going to help me around the house? What if I have young children that need to be picked up and their academic support is necessary during this time, because I usually provided that and I'm not going to be able to provide that? What if I live alone? So that plan is very important. Like, what is going to actually be my plan for navigating this? Here's your plug for mental health counseling. You may want to sit down with a mental health provider and walk through some of those options to figure out what types of things you would need, what types of things might be a benefit, what types of things maybe you haven't even thought about. Find out who that case manager is, knowing what resources are available in the community. And this is where the village really can kick in. You don't even realize who's a part of your village until you recognize and understand that there are so many survivors who want to be able to help other people who are going through this journey to get to the other side of survivorship, that you have allies you may not be even aware of. And then we get to ring that bell and we get to the other side of it, and life is good, and we have children and we have jobs and we have activities, and we get back to all of these things. And then you get the news, because you're going back to do your checkups, right? So you got your screenings that are going to happen depending on what type of cancer you had, what your treatment plan is. Might be quarterly, might be every couple of months, might be monthly. And then you go and you've been fine for years, and then you come back one day and they say the cancer has returned. Maybe it's metastasized, um, maybe it's returned in the same area, and here you are in this place again. And this, again, you all, is a journey, and everybody's journey is different, because you may be at a part of your journey where you don't want to go through that process of treatment again. And this may be the time that you want to say goodbye, right? And people are going to struggle with that. And you get to make that decision. And that's an informed decision that only you can make. Understanding all of the dynamics that are at play for you. That can be really hard. That can be tough on families. That can be hard on an individual. Getting affairs in order. So being able, and there goes that team piece, like where is the insurance? Am I covered? Who needs to know about what those plans are? Have I already got my funeral planned out or my memorial, however I'm choosing to handle my end of life? Have I talked to my family about whether I want to be cremated or whether I want to be buried, and if so, where? Have I let my family know, like, hey, um, I'm getting Social Security benefits, and you're going to need to let them know when I transition. Or, hey, I've got a pension, and so you're going to need to know where this paperwork is and to contact these people. And so, getting those affairs in order, and it's really important to have a legal consultant with you that can help you navigate through all of those things, a will, and being able to clearly outline what's going to happen. And I know for people, like, this is a tough conversation. I definitely remember my mother, and I appreciate it now. I thought it was kind of like dark then, but she would talk to me about all of these things, where they were located, who to contact. And I'd be like, Mom, my gosh, can you please stop bringing this up? But when it came time, and I was a wreck and needed some folks to help me, like, I was able to say, hey, here's where all this information is. And I had everything I needed in order to make it happen. And then the support system kind of filled in the rest of the things and the gaps, like having somebody go with you to the funeral home, all of these things. What happens when, like, I have two people in the same family who may be experiencing breast cancer? Maybe we're in different stages along that journey. And so when my child gets it, and then the things that that brings up for me, being able to support them through their diagnosis and the guilt that I feel and feeling like I passed on things. So as we talk about things coming back, and a lot of for us, like, oh, am I going to be dealing with this for the rest of my life? Sometimes people can get cancer coming back two, three, four, 5 times. And so understanding that dynamic and being able to encourage people and being able to accept, and you may be on the other side of this as a caregiver, being able to accept whatever people's choices are, but also being able to understand what their options are. And sometimes we need people with us that can help us kind of decode. Sometimes you're getting in information and it feels very convoluted, and very technical and jargony, and you don't even understand what it really means and what your options are. Like, what's my success rate with this? What are the side effects of this? And so being able to navigate that in this second time around, the cancer comes back. And so being able to recognize that treatment this time might look different than it did the first time. Maybe we caught it early last time, we didn't catch it as early this time, or maybe it was more aggressive the second time around than it was the first time around. And so, or it's affected different organs this time around. It didn't affect the first time. And so being able to understand those changes, and what happens if the providers, the team that you had, some of those people are no longer in the area anymore, or maybe they're not in practice. And so now I'm having to navigate finding a different team, might have to find a different specialist. So being able to walk through those things. And again, all of the support resources that you identified in that early stage of intervention, like, those still apply here. And being able to talk to people and navigate what your choices are. And so I think it's really important for us to be able to understand, like, it's long term and it's ongoing, and it's a lot of different components. And that you don't have to have all the answers. You don't have to know exactly what to do. Sometimes people want to prayer on it and they want to think about it. They want to talk to their families. And it's important for you to be able to communicate that to your providers, because they're, of course, going to want you to move a wee bit expeditiously, particularly if you have an aggressive form of cancer. And so they're going to kind of give you some parameters, but being able to say, like, hey, I need to take this time and really, because this is a family decision, it impacts the family. And that's why it's important for you, when you are choosing your providers, is to be able to connect with providers who understand your values and what's important to you. Because you may be like, do you pray? Because I'm going to need you to pray for you. Come on, do a surgery on me. I'm going to need to pray for this chemo. All right. So being able to have those kind of things. Being able to take the things with you that are going to give you comfort in that space. Having people that are going to identify for you, like, hey, here are some things you may need some gloves, you may need some compression type things, you may need some different types of blankets, like your skin might get really agitated and everything might feel uncomfortable. Here's what really helps. One of my clients was telling me about a watch that she has that helps with nausea. So there are a lot of different things that you could potentially use, and sometimes it's about asking people, like, hey, what are some of the common things that people have utilized when they've received chemo or during this process of receiving radiation, and that's where that support group can come in handy. So I want you all to recognize that in this journey of prevention, for those of you who want to kind of just be aware of what is out there and what the options are, and making sure that you're doing your preventative care programs, but also making sure that you are aware of things in the event that there is a diagnosis between you or anyone you love and care about. And also for those who may be in this phase of intervention, or maybe in this phase of where your cancer has returned and kind of navigating end of life issues, that you do not have to figure it out on your own. And I will tell you that the load is much lighter when there are other people to bear it with you. No, you're not being a burden. No, people are not tired of you. No, because you don't have energy and your hair is falling out doesn't mean that people don't love you. Doesn't mean that you're not beautiful and that people don't want to show up for you. But people want to be respectful of whatever your boundaries are. And so that's why it's important to be able to ask for help and identify those people. And everybody's not going to be able to be a part of that support for you, and I think that's really important too. There may be some people that are like, oh, I can take you to appointments and I can show up with you, but they're just not necessarily a person that you would feel comfortable being in that space. And that's okay. Being able to tell people, like, I so much appreciate you wanting to show up for me and support me, here's the ways you can. Right? So giving people different tasks, because somebody might be the one to come over and wash your clothes. And I know some of y'all are real prideful and you don't want people washing your underwear. However, when you're in a position where you're not going to be able to take care of those things, it's really important for you to understand that everybody's seen bodily fluids. It'll be fine. Just tell them to wash them in the delicates and get your unscented detergent and allow people to be able to help you. And this is where the pride piece can be real tough. We don't want people bathing us. We don't want people see us naked. We don't want people seeing that we're kind of falling apart because we're used to having that image of. But I will tell you that cancer is very humbling. And it is my sincere hope that you recognize that there are people that love you and want to be able to be there for you, and they're not going to be judging you and telling people about your business, because they're not the people going to put in our support system, right? But that people want to be able to show up for you in ways that you have likely shown up for them. So do know I'm rooting for you in whatever stage you're in. If you're in prevention, go get that mammogram. I'm proud of you for doing that. Your monthly breast exams. I'm so proud of you for doing that. Noticing changes in your body and something doesn't feel right, and you go ahead and you make that appointment and don't talk yourself out of it. For those of you that go and get at those early screenings, you follow through with those treatment recommendations. You do the things that you can to be well. For those of you who are in this journey of navigating with your families and figuring out end of life things, like, we support you in whatever decision you make to be in the best interest of yourself and your family. For my mother, this is in memory and honor of her. And for all my survivors out there, we are thinking pink on your behalf, and you keep on fighting, because we're right here underneath you in this fight. Okay, everybody, be well.